Welcome to the Emergency Department at Christiana Hospital. At Christiana Care, we promise to serve our patients as respectful, expert-caring partners in their health. We call this the Christiana Care Way. As part of our commitment, we're dedicated to delivering quality trauma and emergency care to you and your family. As a leader in patient and family-centered care, we treat each patient and their loved ones with special care and concern. Patients who have health problems that are life-threatening or may result in permanent injury will always take priority. Christiana Care doctors, nurses, and support staff are among the most skilled emergency experts in our region. They work together as a team to make sure you receive high-quality care in as timely a manner as possible. If you're watching this video in our waiting area, this means you probably have already checked into the emergency department. A nurse in our triage area asked you about your health problem when you checked in. You were asked about the reason for your visit and key medical information to help us determine the severity of your condition. If it hasn't happened already, an emergency care technician will take your blood pressure, heart rate, and temperature and will assist you with other care as directed by the triage nurse. A tech may also perform an EKG if necessary. You may have only one visitor in the triage area as the space is small and we need to maintain privacy for you and our other patients. After triage, the nurse will prioritize how your care will be delivered. Many factors may play a role in deciding what is done first and where your treatment is provided. Our team looks at how severe each patient's health problem may be and determines the most appropriate resources for evaluation and treatment, as well as the order of the patients who need this care. Patients who have life-threatening health problems or issues that may cause permanent injury will always have priority. Patients with less urgent health problems will be treated as soon as possible. We are committed to serving everyone to the best of our ability. Patients with minor injuries and illnesses may be sent to the SuperTrack area. Because this area is designed to manage minor problems, patients are usually treated and discharged in less time. Although your medical history may be stored in our electronic record, we always review this information with you to verify if there are any changes. Please tell us as much as you can about your history and your health problem, as it will allow us to help provide you with the best possible care. Here are some things you need to know. If English is your second language, we're happy to provide care for you in your native language, free of charge, through an interpreter. We offer sign language interpretation for our deaf and hard of hearing patients and their families. Ask any staff member for assistance.
Si usted habla español, con gusto le brindaremos servicios por medio de un intérprete de español que le ofrecemos de manera gratuita. Ofrecemos intérpretes de lenguaje de señas para nuestros pacientes sordos y sus familias. Solicite este servicio de cualquier empleado del hospital.
When the emergency department is busy, wait times can be long. We'll make every effort to tell you about any delays and keep your wait time as short as possible. Please feel free to ask the staff about any concerns you have. Please don't leave the waiting area unless you let the nurse know. If members of our health team can't find you, they may think that you've left and move on to the next patient. Telling the nurse your plans will ensure that this does not happen. Please wear your ED tracker badge at all times. It helps us find you. Your ED tracker badge will not work outside of the emergency department. We always recommend that you are seen by a healthcare provider, but if you choose to leave before seeing a healthcare provider, please let a staff member at the front desk know you are leaving. Your comfort and health are important to us. If you feel your health problem is getting worse, let our staff know right away. In order to stop the spread of infection, if you are coughing or sneezing, please cover your mouth inside the bend of your arm. If you're coughing or sneezing, you may be asked to wear a mask to protect other patients and their family members who are waiting. Washing your hands or using hand sanitizer often is the best way to prevent the spread of infection. Please feel free to use the hand sanitizers in our waiting room. For your safety, very few medications will be given to you while you're waiting. Please feel free to talk with the nurse if you have any questions. Please don't eat or drink before you see the doctor. This could delay your testing and treatment. If you have to use the restroom while you're waiting, please let us know. A urine sample may be needed as part of your treatment. Our staff can give you a urine sample kit in an effort to reduce the time you would spend waiting for results. We try to maintain a safe and comfortable setting for visitors and staff. You can also ask us to lock your money and valuables in our safe. Any staff member can assist you with this. When you arrive in a treatment area, our team of Christiana Care health professionals will take care of you. Regardless of why you came to the emergency department, it's important to give the nurse a complete list of your current prescription medications, over-the-counter medications, or herbal supplements, and any allergies you have. Your care may include tests to check for health problems. Tests provide important information to your caregivers. Please keep in mind that tests take some time to complete. Depending on the size of the treatment area, we typically allow 1 or 2 visitors per patient. For everyone's safety, all visitors are asked to stay in the patient's room to keep hallways clear and protect the privacy of other patients. At some point during your visit, a registration clerk will come to talk to you to verify your address, emergency contact information, and request your insurance information. If you cannot pay for your hospital bill, please let us know. We have a financial assistance program that may be able to help you. For more information, please call our customer service department at 302-623-7000.
Si usted no puede pagar su factura del hospital, por favor déjenos saber. Tenemos un programa de asistencia financiera para ayudarle. Para más información, por favor llame a nuestro departamento de atención al cliente al 302-623-7000.
After you've been assessed and treated in the treatment area, a decision will be made about the next step in your care. You may be discharged or admitted to the hospital. If you're discharged, you'll be given written instructions on how to care for yourself and any follow-up care you may need. Please let us know at that time if you have any questions or if there's anything else we can do for you. After your emergency department discharge, you may receive a feedback survey in the mail. Your feedback is important to us and helps us improve our care. If you're being admitted, you'll be assigned a room in the hospital. You may have to wait in the emergency department until a room is ready. Many things influence when hospital rooms become ready. We're always in communication with the other hospital departments to make sure you know when your room is ready. Christiana Care is not responsible for any money or valuables in your possession. Please ask your family member or friend to take your money and valuables home, or ask a staff member to lock them in our safe. Our emergency department at Christiana Hospital is always open and ready to care. We want your visit to be as comfortable as possible. Please talk to your nurse, doctor, or any member of the healthcare team if you have questions, concerns, or feedback about your care. Thank you for choosing Christiana Care and allowing us to be a partner in serving your healthcare needs.